Good morning, everyone. We're here to discuss this IMD, IMD number 7, Pathway to Settlement, UK Government Consultation on Earned Immigration Settlement. I've got Councillor Stephen Conway to make a decision, and I've got Peter to present the report, please.
Thank you. So late last year, the Home Office released a paper and a consultation on settlement for migrants in the UK, and it was proposing a number of changes that they then went to consultation with to whole society. So the VCS Council and other parties were invited to respond. Our response was compiled by adult social care, children's services, community partnerships, housing and patient growth. There's a broad cross-section of the council reflecting the significant impacts that we fear that the changes could have on council services and on the people we support in our communities. So broadly speaking, in our response, we suggested there needs to be more of an equality-led approach. It does not actively disadvantage people who are unable through no fault of their own to enter jobs that are required to get settlement or achieve a high level of English. So probably worth also outlining what the changes would be. So they're proposing to increase the time from entry to receiving immigration settlement 10 years as a baseline, and then a number of factors such as employability, employment, salary income and English level would then increase or decrease their length of time to achieve settlement. So we fear that some people, people with care responsibilities, people who are in the UK on refugee visas, on the refugee status, would not be able to demonstrate these conditions. There's proposed changes that if individuals access public funds, that could also increase their wait time from 10 years, possibly up to 15 to 20 years, which we feel is detrimental to efforts to integrate people from overseas in our communities, and it would prevent people from accessing public funds when they need them most, which creates cyclical issues for the council in terms of homelessness and emergency services too. So we think there's some big impacts here that need to be addressed, and the concerns are that the costs and the impact will have to be picked up by local government. The other main concern is that by setting high thresholds for employment skills level, English language level and salary, our efforts to recruit internationally for the adult care sector is going to be significantly hampered. There's been a lot of work done in the last couple of years through funding and through big capacity building across the sector to increase international recruitment, but these changes could potentially make the UK a less attractive place for people to come and work here, and increase affects our ability to retain staff as well.
Okay, thank you very much, Peter. The purpose of this individual executive decision is to endorse the response to the government consultation that we've already submitted. We central objection to the consultation, I think, of the proposed changing approach by the government is to increase the number of years that foreigners are waiting to achieve settlement rights, scope to shorten the length of that period depending on a variety of circumstances. We believe that the proposals need further clarification on important matters such as eligibility for exemption, and we believe careful consideration by government is very unfortunate and have unintended consequences. Seems to be a risk that the income and English language requirements would discriminate against people with caring responsibilities, care leavers, and those with long-term health needs. There's issues there, I think, should properly addressed. And the proposal to reduce access to public funds could have the effect of increasing the need for emergency support provided by the council and the overstretched voluntary and charitable sector. At the very least, some uplifting funding for the council and partners in the charitable sector would be required to address this challenge. And we're also concerned, largely, and defining points for this will be made, we're also concerned that those changes will make it more difficult to retain overseas staff on which much of the social care sector relies. So those are points we sought to make in our response. Thank you. Ready to sign? I think we probably should amend the wording so that it reflects the fact that it's a decision that to endorse submission already made to the proposed changes and
I think we could just cross this and then write everything here. Yeah.
I could say it's full words now. To endorse, approve.
Yeah,
I think
that's
that's
it.
position.
Thank you. That concludes this meeting.